So what is perimenopause? So perimenopause is a completely natural transition that we will all go through, and it's the time before menopause. And it can last from anything from 2 to 4 to 10 and even more years. So menopause is defined as the time when we don't have a period for a whole year. That day, that moment is classed as menopause. The time before that is classed as perimenopause. And the average age for menopause is 51, and the average age for perimenopause is 44. But that can differ a lot. Some women will start to feel symptoms of perimenopause in their late 30s, and some won't feel the symptoms until their mid-40s. So what are the symptoms of perimenopause? So often the first symptom is that our periods can start to change. So I'd really encourage you to start to track your periods. So your periods can get lighter, they can get shorter together, or they can get longer and they can get heavier, or they can actually do both. And this can be quite disempowering, especially if you're someone that's had a regular cycle all of your life. So other symptoms, feeling hot at night and having disturbed sleep, feeling a little bit more anxious, having increased PMT, weight gain around the middle, that no matter what you do, it's quite difficult to budge, feeling achy in your joints, and not feeling yourself. So just feeling like things that you love to do, go for a walk with your dogs, you're like, oh, can't be bothered to do that. And often it's just this kind of, these feelings that come from nowhere. Your life can be going really well, and then all of a sudden you feel yourself really emotional, crying more than usual, feeling really sad, but it doesn't feel the same as depression. It feels different. And as women, we're very connected to our intuition. So often we know that something doesn't feel right. Now, obviously, if something doesn't feel right in your body, it's always good to go to the doctor and get a check to rule out everything else and make sure that you are healthy. But sometimes when we feel that we're going through perimenopause, we'll go to our doctor and our blood tests come back normal and we're told to go away, and we can feel really frustrated because we know that something is going on in our bodies that's not the same. Now, according to the NICE guidelines, after the age of 44, a woman can be diagnosed just by her symptoms. So it's very important that we know our symptoms. So officially there are 34 symptoms, but I'm sure that there are a lot more. So the obvious ones I've mentioned, I'll just go through them again. So changes in your period, sleep disturbances, feeling a little bit low, having hot moments, and these can also be tingles and chills, feeling more tired, sometimes complete exhaustion, having breast pain, not being able to shift weight, your skin being dry, your hair being drier, even your dry mouth, having constipation, having increased blood pressure, having dry eyes, dry hair, headaches, urinary issues, more UTIs, and there are many, many more symptoms. But often this feeling that something is not quite right. And so as I said, our periods are often the first thing, but we all are very different, so we can experience things very differently. Personally, I experienced anxiety and had weird things like I didn't want to drive at night. That was one of my weird symptoms. You can go off with certain foods. But the good news is that there is lots that we can do. We're not alone. And often at this time of our life, we can feel quite alone. Sometimes our friends are not going through it, they don't understand. And we can feel quite isolated, especially with things like libido and rage and feeling emotional. It can really start to affect our relationships. So the good news is you're not alone. I trained as a menopause mentor, especially so that I can help women through this transition. When I started going through perimenopause, I felt very alone. I didn't really know what was happening in my body, and I didn't really know how to manage it. So I decided to train so that I could help women like you to navigate this overwhelming area. You know, should we take HRT? Which supplement should I take? How can I change my diet? I want to exercise, but I'm feeling tired. And we can feel so overwhelmed that we're just like, I don't want to do any of it. So I'd really like to guide you through this time, show you some really simple techniques and some really simple ways that you can change your lifestyle to make this transition a happy transition, and to teach you how to go with the flow and how to ride the ups and the downs, of which there are many. So I'd like to invite you to book a menopause mentoring session with me. My sessions are an hour long, and we can go through whatever you want to go through. I've got a little application form that I'll invite you to fill in before, so we can see where you're at and we can see what you really need the most support with in our session. So please book a session with me today. And if you would like to try some yoga that is specifically for women that are going through perimenopause and menopause, then hormone yoga is the ideal practice for you. It really, really helps us. It boosts and balances our estrogen and our progesterone and helps us feel more balanced in our daily life. So if you would like to join my next hormone yoga course, then please do reach out, because spaces are limited. And thank you for watching today.